Are blood substitutes an effective and safe alternative to blood transfusions? Yes, they are, and I'm going to explain to you why. First of all, there are many risks involved with blood transfusions. There's blood-borne infections that can occur in a patient, such as HIV, hepatitis C, hepatitis B, West Nile, sepsis. These could take even years to develop in a person to realize the effect of a blood transfusion. There are also other diseases such as acute immune hemolytic reactions where the blood type that you are given isn't compatible with yours. So you have an infection. There could be iron overload from excessive transfusions, where you actually have to have treatment because this can actually ruin your kidneys for people that get excessive transfusions. Other things are there could be mild or severe allergic reactions associated with blood transfusions that can happen in patients, such as anxiety, fever, chills, quick pulse, low blood pressure, and things like these. So, what are some transfusion alternatives? This is not a very common thought about thing until in the 60s when in the Texas Heart Institute, Dr. Cooley actually did the first open heart surgery without the use of blood. So some of the alternatives that we have are volume expanders such as saline, Ringer's lactate, albumin, purified protein fractions, and these increase the fluid within the body, but they don't actually change the number of cells, blood cells. So they just provide that extra fluid that's needed for the body to survive. Another thing is blood salvaging, where someone's blood can actually be circuited outside of their body in a closed circuit, cleansed and then put back into their body. So this can happen in a surgery where someone loses an excess amount of blood. So instead of having blood transfusions, they're actually using their own blood in a closed circuit. There's also other things that can be done during surgery, such as collagen, cellulose pads, and sealants that will actually plug the puncture wounds and suppress excessive bleeding during surgery. There's surgical tools that are less invasive, and some that can even cut and seal blood vessels simultaneously, so you don't have that excessive bleeding. There's other longer-term things, such as if someone is going to have a surgery and they want to plan for it, they can take these growth factors, which are lab-created hormones that actually boost red blood cell, white blood cell counts, or platelet counts. So it's something you can do in advance. It wouldn't be ideal for an emergency situation, but it's something you can do in advance. So what are the costs and the benefits? 1 unit of blood can cost $700, with a total of $1,500 to the patient. Heart surgeries without transfusions are performed with fewer complications, and they can, if they're bloodless, they can be $16,000 versus $23,000 with blood transfusion. So a significant savings. The benefits are there's fewer complications, faster recovery time, shorter hospital stays, less chance of infection, which is a big one, faster time for healing wounds, and it minimizes the loss of blood before, during, and after the surgery if blood substitutes are used in these other procedures. So, in conclusion, blood substitutes can significantly reduce the risk of blood-borne infections in patients and decrease the overall healthcare costs, which is something that our country is trying to do now, is reduce costs. So by being more educated on what those blood substitutes are and the different ways that this can be done, people can have a better education going into that kind of situation to know what the alternatives are. To put it in perspective, there are over 500,000 heart surgeries performed annually. This could be a potential savings of $3.5 billion a year if people knew and people actually use these blood substitutes as alternatives to blood transfusion. So that's a little bit about that. Are there any questions or comments?